Hello everyone, and welcome to my YouTube channel. If you are passionate about public health or environmental health, or you are that person who wants to solve real world problems, you are on the right platform. So today we are diving deep into community diagnosis, which is a key process in public and environmental health that helps us understand and improve the health of a population. If this is your first time here, don't forget to subscribe and support me. Your subscription helps me to continue creating educational content for students, for health workers, and anyone interested in making a difference in their community. So let's get started. What is community diagnosis? Community diagnosis is like a health checkup, but instead of focusing on an individual, it assesses the entire community. It provides a comprehensive description of the community's health status, the factors influencing the health, and the challenges that need to be addressed. According to the World Health Organization, community diagnosis can be defined as a quantitative and qualitative description of the health of the citizen and the factors which influence their health. For example, let's say we have village A. It's a rural village where many children are suffering from frequent stomach illnesses, and villagers might think it's due to bad luck or seasonal changes. But through community diagnosis, health workers might discover that the real issue is contaminated drinking water. And these diagnoses lead to practical solutions, such as improving water sources and teaching residents about water purification. So in short, community diagnosis identifies health problems, proposes solutions, and stimulates action to improve the overall well-being of the community. But why is community diagnosis important? Community diagnosis is so important for several reasons. One, it provides evidence-based decision making. So community diagnosis ensures that health interventions are based on real data. For example, if malaria cases are high in a rural area, community diagnosis helps identify whether the cause is stagnant water, lack of mosquito nets, or poor drainage systems. Community diagnosis empowers communities. It involves community members in identifying their own challenges and solutions, making them more likely to support and sustain improvements. For example, if your community sees that unsafe drinking water is causing diseases, they will be more likely willing to participate in solutions like boring water or building bores. Optimizing resources. So it helps allocate resources where they are needed most. For example, if both malnutrition and respiratory diseases exist in a village, but malnutrition affects small children, resources will be directed towards improving nutrition and food security first. Then the last one is sustainable change. By looking at social, environmental, and economic factors, community diagnosis helps create long-term improvements instead of short-term fixes. Don't forget that community diagnosis identifies problems, proposes areas for improvement, and stimulates action. Like if open defecation is linked to frequent diarrhea diseases, the solution could be building latrines and educating the community on hygiene practices. Before I talk about the steps and how to perform community diagnosis, let's explain the key terms. Community analysis. Community analysis is the process of examining collected data to identify health needs, barriers, and available resources. So the product of community analysis is community profile. Now, what is community profile? A community profile is a detailed summary of the community, including population size, health conditions, economic activities, and available health services. For example, a village with 5,000 residents with poor sanitation and high rates of malnutrition would need different interventions than a urban community with different challenges. And lastly, what is community assessment? Community assessment is the process of collecting all relevant information about the health conditions, risks, and available resources in the community. For example, if assessment reveals that 90% of households lack toilets, interventions can focus on improving sanitation facilities. So understanding these terms helps us to appreciate the depth of community diagnosis and its impact. Now let's talk about the steps to perform community diagnosis. So how are you going to perform community diagnosis, and what steps are you going to follow? Don't forget the definition of community diagnosis. Community diagnosis, I defined it as a quantitative and qualitative description of the community's health and factors influencing their health. The first step in community diagnosis is determining objectives. Ask, what do we want to find out? This includes health issues and community needs. For example, if many children in a village have diarrhea, the objective could be to determine if the cause is related to water, sanitation, or nutrition. The next step is study the population. So here you are going to define who you are focusing on. So specify the population where the focus of diagnosis will be. Determine data to be collected. So here you are going to collect data that is needed. And this data could be health, environmental, or social data, such as age, gender, population size, common diseases, sanitation levels, economic activities, or education levels. So the data can be collected using or through appropriate ways, such as screening, contact tracing, and interviews. Data presentation. Present data in an accessible and understandable format. You can use charts, graphs, and maps to make findings easier to understand. For example, a bar graph showing that 60% of children were underweight will help health workers plan nutrition programs. Data analysis. Identify trends and patterns in the collected data. Problem identification. Clearly define the main health challenges in the community. For example, if your analysis shows that unsafe drinking water is causing diarrhea, then improving water quality becomes a priority. And lastly, priority setting. Focus on the most urgent health issues first. For example, if malnutrition and malaria are both issues, but malnutrition is causing child death, it should be addressed first. By following these steps, we can develop effective community-driven health solutions. What is the first step in performing community diagnosis? Is it data analysis, problem identification, determining objectives, or priority setting? The correct answer is C, determining objectives. You need to define what you are investigating before collecting data. That brings us to the end of today's discussion on community diagnosis. This process is vital for improving public health and environmental health, especially in rural areas where resources are limited. So if you found this video helpful, please like, share, and subscribe. Your support helps me continue creating informative content for public and environmental health students and professions. So let me know in the comments what topics you would like me to cover next. Thanks for watching, and I'll see you in the next video.